Good morning,
Is it urgent for today?
What's the best number to call back on?
It's another busy day in Nicholstown Surgery, in the heart of Southampton. Across Southampton, a city with a population of about 250,000, thousands of people are being seen daily in primary care settings.
Okay, so what was the problem? Okay, can I take your date of birth, please? Okay, that's fine. I'll pass that on to the doctor and they'll give you a call back this morning. Okay.
The number I have
Nicholstown
registered
Surgery, can I
here
help
is
Yes.
29
Good morning, Nicholstown Surgery, can I help you? Good morning, Nicholstown Surgery, can I help you?
It is mid-September and the staff are getting ready to offer free flu vaccines to those eligible.
Thank you.
Lovely, thank you. Okay.
As 1 in 3 residents in Southampton live with multiple long-term conditions, protecting them from further complications throughout the winter, it's as crucial as motivating people to lead healthier lifestyles.
My job title is practice nurse at Nicholstown Surgery. So a practice nurse looks at a lot of chronic disease management throughout the surgery, and it is often used to be called a surgery nurse. But also we do things like NHS health checks, and also looking at travel advice and travel immunisation as well. The NHS health check is an opportunity for us to review patients who we may not see under the chronic disease management. People we're trying to pick up really who may have an underlying or predisposed condition that may surface later on in life. So it's our opportunity to talk about healthy living, looking at diet, looking at exercise, and also looking at things like alcohol and smoking and reiterating the health benefits of limiting those things and those activities. We also give opportunities for people to see dietitians or our health trainer, and also look at exercise programs within the city that can assist people to make small changes to their lives to make big health benefits.
Have you been here for a long time at this practice?
Yes, I've been here for 8 years now, but I've just got a new job.
Where?
Still here, but as an advanced nurse practitioner training. So I'm training to have my master's eventually, so that I can just prescribe. So currently at the moment I can't prescribe, so I have to go to the GP for any prescriptions that I might need. So hopefully I'll be at the stage where I won't need to do that so much. Part of what I wanted to do was just learn some new skills, adapt myself. With things moving more and more towards primary care, I wanted to be part of the future in Southampton.
So advanced nurse practitioners have actually been around really quite a long time, probably at least 15 or 20 years. Using them within the GP practices, that's a fairly new initiative. Within Solent, we've been using advanced nurse practitioners for the past 2 years, and the response has been phenomenal. The response from the patients, being able to have availability to have appointments with us, and also the response from the GPs of us freeing up some of their time and enabling them to see the more complex patients. It's gone down really well. The difference really between nursing prescribing and GPs prescribing is that the GPs would be able to prescribe for anybody. They won't necessarily have had to have physically seen the patient, whereas it is a rule for us that as nurses that we do need to examine the patients ourselves. Hello, it's one of the nurse practitioners calling from Nicholstown Surgery. How can I help you today?
In recent years, some GP practices throughout Southampton have introduced telephone triaging as an alternative method of contact for patients who feel they need to speak to a clinical person urgently.
Actually, people really do they like the fact that they can speak to a GP. It can be at a time that's quite convenient to them, and often the wait for a telephone call is quite a lot less than a routine appointment for the GP. There's 16 on our list today, but that will continue to be added to until 11 o'clock. On average, we normally have between 40 and 50 callbacks to do in the morning.
And how many hours is that if you say 40-50 calls within 2 hours or whatever?
We call them between 8 and 11, and normally we're triaging fairly close until 11 o'clock when we start to see patients.
I think it's really good. I think it really takes workload away from the GPs and allows GPs to concentrate on what they're trained to do, which is to deal with those more complex patients. Dr. Kelsey, how can I help?
I was asked to attend this appointment regarding my diabetes.
Oh, right, okay.
Dr. Mark Kelsey has been working for the past few years on ways of using widely available technology to facilitate increased patient access.
Recently, one of the interesting things is being able to give patients access to online services. So for probably 18 months now, patients have been able to order repeat prescriptions and book appointments online. And we're trying to encourage more people to do that because it does help the practice work in a more streamlined way. It frees up the phone lines for people who do need to phone in and speak to somebody. The other thing which builds on that is online consultations, so allowing patients to go through a website and fill in details about what their problem is, and then that gets sent through to a practice as a message that they can then act on. So that can then either go to a GP or a nurse or an admin person, depending on what the query is. There's a few practices in Southampton that are already doing it and are finding it quite useful, and they're finding it beneficial for their patients because it's easier for them to get through and do it online than it is to wait for someone to speak to on the phone.
Southampton, like other cities across the UK, has been confronted by the challenge of recruiting medical staff, doctors and nurses to cope with an increasingly complex population. New housing, an ageing population with more complex needs, a young student population, they all have an impact on the local GP surgeries.
We've got 6,800. When I started 4 years ago, we had about 4,500. So the list size has just boomed. We've had some student accommodation built locally as well. So that again has increased our patient population. There is a new housing estate being built down in Northern, and we'll be the closest practice for them.
Understandably, GPs and practice nurses are increasingly looking to work more flexibly in order to fit in other work and family commitments. One of the solutions to this is to share the workforce and admin duties between surgeries who are willing to work together.
Might be.
We're done the meeting when you're ready.
Yeah.
Right.
What we're seeing in the city is practices are starting to work more together and group together into larger practices, and then I think that's a good thing because that helps give them a bit more stability, makes them more likely to be able to attract doctors in to come and work for them. What we've tried to do from the CITYWIDE point of view is to encourage practices to start looking at this because of the problems with recruitment and with the funding. Actually, the funding probably isn't going to improve in the next few years, so we have to find other ways to try and make practices work better. So a few years ago we did start to talk to practices about coming together into larger groups, the benefits they could get from that around, being able to share some of their staff and do things once across a group of practices rather than every practice having to do everything for their patients. So you get that economy of scale. But it's very much down to the practices to decide they want to do that. So they have to find other practices that they can work with and that they share an ethos with, because all the practices are very different. They're all very much run by the GPs and shaped by the GPs who work there.
Earlier this year, in April, Nicholstown Surgery merged with Portswood Surgery and Adelaide Surgery in Millbrook to form Solent GP Surgery. While the Portswood and Nicholstown branches of the practices are open 5 days a week, Adelaide is open to all Solent GP surgeries, registered patients 7 days a week.
Well, I'm working from 8 until 8 today, so it's a long day today.
The key thing for me is getting across to people that we are open 7 days a week, 8 till 8, so anybody ringing in can be seen within that time by an advanced nurse practitioner or a GP. We will go in each evening and send a text to all the patients that are due in the next day just to remind them they've got the appointment, as some of them are booked a good few weeks ago. We still get maybe 6 or 7 a day that don't turn up.
Without any notice?
Yes, yeah, even though they may have had a reminder, they still just don't come in, don't let us know, so we can't reuse those appointments.
Another significant challenge to the city is the volume of people attending our A&E department, also known as the emergency department. According to the Clinical Commissioning Group, 1 in 20 Southampton patients who attend the emergency department could have been seen quicker and closer to their home for their condition by going elsewhere, such as their local pharmacy, minor injuries unit or local hub.
I'm here for the hub service, which is run by the out of hours. SPCL stands for Southampton Primary Care Limited, and it's for a service offered for patients who cannot get an appointment with their usual GP during the week, people who work, etc.
On a weekend, the Adelaide is run by the advanced nurse practitioners. And their day runs similarly, so patients call requesting an appointment, they get put on the triage list and the advanced nurse practitioner calls them back. If we decide that the patient isn't appropriate to be seen by an advanced nurse practitioner, then we have our GP hub service that's available that we can call and book into, or we're also able to contact the 111 service on behalf of the patient and request that they have an appointment. So the hubs are run by the GP Federation. They're run through different sites across Southampton, and they are run out of hours, so they're run evenings and weekends. They're available for surgeries to book their patients into. That doesn't have to be urgent appointments, it can be chronic reviews. They also have GPs, they have nurses, and they have advanced nurse practitioners as well. So we can call them up and request an appointment, and then the patient can be seen by them.
So working very much with our GPs, building up primary care services, providing services in the community. We have done a lot over the last 5 years to reshape what people can access outside hospital. And I am proud of things like the MSK service. Obviously I don't deliver those. I think the people who deliver that service deserve all the credit. But we have commissioned integrated COPD services in the community, the MSK and pain rheumatology service. We have more GPSIs than we had before. So I think part of me feels that we've done what we said we'd do. We've allowed people to be seen closer to home in the community, and we've freed up capacity in the hospital to do that. And I have to say it's also saved quite a lot of money.
There we go.
We know people in Southampton really value the work of GP practices and their staff. That is why Southampton City CCG is working with local GPs, nurses and other NHS staff and local communities to help us find solutions to some of the big challenges we are facing. We want to hear from you. Please share your views with us.